Sleep disturbances are not uncommon in Parkinson's disease. Patients with Parkinson's disease may experience difficulty falling asleep at night time after going to bed, or have multiple awakenings during night with difficulty falling back to sleep again. Poor nighttime sleep may not only cause excessive daytime sleepiness but also affects daytime functioning. On the other hand, if you have Parkinson's disease, a good night's sleep can help you better cope with your symptoms. Some patients may notice improvement of their symptoms for a period of time after waking up in the morning. Besides Parkinson's disease, there are many other conditions which may interfere with your sleep, such as sleep apnea, depression, excessive daytime sleepiness, anxiety disorder, overuse of caffeine and nicotine, and some medication used for other medical conditions. Patients with Parkinson's disease may have difficulty turning in bed, stiffness, need to urinate multiple times at night, pain, numbness, tingling, toes and foot curling, nightmares, vivid dreaming and visual hallucination, which may interfere their sleep. Salicyline is a medication used for Parkinson's disease which may act as a stimulant in brain and cause difficulty falling asleep if taken later in the evenings. So the last dose of this medication should be taken in the early afternoon. In order to find the exact cause of your sleep problem, you may need to observe your sleeping routine closely. One thing you should pay close attention to is the time at which you fall asleep. Do you fall asleep while in company of other people, watching television, before or during your midday meal, riding a car, or when reading? Another aspect of your sleep routine is to note down the quantity and quality of your sleep at night time. This includes the time at which you go to bed and wake up in the mornings, the duration of time it takes you to fall asleep, and amount of sleep you get, whether you take something in order to fall asleep, and how many times you wake up during the night time. In particular, you should note the number of times you need to wake up to urinate. You should discuss this information with your physician so he or she can give you advice to help you sleep. You should try to follow the principles of sleep hygiene, including regulating the sleep-wake cycle, going to bed and waking up regularly at fixed time even on the weekends, regulating the amount of sleep obtained each night, exercising daily and regularly but not in the late evenings, sleeping in a quiet environment, avoiding alcohol, avoiding caffeinated beverages in the evening, and doing something relaxing before the bedtime. One of the other factors that may help you sleep better is healthy diet along with a healthy weight. You should not go to sleep hungry or after a full meal, and you should not take fluids before going to bed so that the bathroom trips at night time are avoided. You should take a short nap daily in the afternoon, but make sure that this nap is not longer than an hour, or otherwise it may interfere with your nighttime sleep. You should make sure that your bedroom is very quiet and comfortable. You should use bed for sleeping and avoid reading while in bed. You should use a firm mattress and a soft pillow as it can be adjusted easily. You should wear comfortable and loose clothing. You should sleep on your right side. You should consider sleeping on a separate bed if sharing a bed with your partner prevents you from getting a good night's sleep. This information is provided for educational purposes only and should not be taken as a substitute for the medical care and advice provided by your physician.